level and national board meetings. She is a member of the 100 Black Women, and she heads the policy committee there. And then she is going to talk about children and infant health. And along with her, Joel and Lynn Archibald for My Baby for Me, and you will hear more from them later. So at this time, I want to give you something to think about. As a professional courtesy, we're going to let the fire department go first because, of course, if they get a call, they have got to go. So I hope that you will indulge them in that. But these are some things we want to think about. You remember when you were in school, when you were young, and they used to have fire drills, and everybody lined up and went outside until they rang the bell and you came back in. Now, things have gotten a little more serious, and the schools are prepared for active shooter drills and stuff like that. So, Lieutenant, take it away.
Thank you. I'd have to say a lot of the education and safety comes into play when children are, say, anywhere from ages 3 and up. And the Fire Museum of Memphis has something to offer with that. So part of our budget for the Memphis Fire Department goes to the Fire Museum. The Fire Museum has 3 to 5 employees, and they also get a budget, and they have the facilities set up to educate children when they go in to learn about fire safety, learn about what to do in case of a fire, and to help them prevent fires, and who to talk to in case they see people starting fires, and how to talk to their parents about having smoke detectors installed and things like that. When it comes to that, it's important to tell them, on how to take care of themselves, how to take care of their family, how to exit a house if they have fires or anything, and that nature. So what we try to do is we try to get kids to go to the museum when they're grades 1, 2, 3, and 4, and that's usually what they do. So they can go, once, twice a year, and in that aspect. So that's one of the things Memphis Fire Department does to educate the youth in Memphis is that. So, is there any questions on that? Okay. So what else would you like to talk about? There is, and that's one of the things that's in the museum is that they have a fire safety panel, and annually what we do, usually we do in the spring, is we'll go out neighborhoods and go door to door and actually pass out free smoke detectors and hang them. And we'll knock on the door, we'll leave a notice if no one answers the door. So I don't know if you've ever had that happen. You probably have in your neighborhoods if you live here in Memphis, that we'll go door to door and knock on the door and actually make sure that someone has a smoke detector. If they're willing to answer and willing to let us install it for them, we'll do it. So that's one of the things we do for that. Does anyone else want to talk on anything else? As far, okay. It's open. Absolutely. All you got to do is call and coordinate. It's at 118 Adams Street, and that's right down the street. You call them, coordinate it. You can have the teachers call them, a principal call them. You know, like someone called and set us up for this event. So just like we're coming out to talk to you guys. So whatever fire station is in that jurisdiction, wherever you want us to go and talk to kids or talk to people about it, we're willing to go do it. Whether it's a senior citizen center or whatever, you know, we're willing to go there. So, but as far as percentage of people being prepared, I mean, that's hard to say. You know, it's based on what are you prepared for? You know, I mean, you're prepared for a fire, you're prepared for an earthquake or whatever, you know, but the best thing you could do is for parents, grandparents to teach their kids, you know, what to do in case of an emergency. Just be prepared for any type of emergency, whether you have a car accident, house fire, or, you know, something going on down the street. You just got to be prepared daily, you know, for whatever may happen, you know. No, I mean, we have FEMA for that. So FEMA's going to, you know, you can get it online, you know, so there's not too much training that we could do for the public on that, just being overall safety, you know, as far as like for tornadoes or earthquakes or anything that happens. I mean, if you can call 911, call 911. I mean, everyone's going to come out. They're going to bring communication towers to be able to communicate. You know, cell phone signals are down, so they'll make sure that, you know, we're able to communicate and help who needs help first. You know, something so big like an earthquake hasn't happened here in so long. You know, no one's really going to know exactly how to act until it happens. But, you know, we're pretty good at being prepared for most things. So. What's the question again? You said, what would we do about a hotel, commercial property? What do you do if you're on a 10th floor hotel and a fire breaks out? Okay, first thing you're going to do is not use the elevator. First thing you're going to do is find a stairwell. Usually most hotels will have a stairwell on either side of the building. So when you check into a hotel, that's one of the things you could do is tell the people you're with, say, hey, in case something happens, you know, it could be anything that happens. You know, it could be a flood that happens in a hotel. Sometimes they'll have flooding going in the walls or whatever, how to evacuate the hotel. So each hotel has posted in their lobby escape routes. So that's why, say, if the power shuts down, you have the exit signs that come on at the doorway so you know which direction to go. So the exit signs are on the stairwell. So each hotel, by law, they're going to have an exit sign at each of the floors, and you got to exit on that stairwell. So what you want to do is get out of the building. You know, that's your plan is to get out of the building. So you can do that by learning when you go to whatever building you go to, whether you live in a high rise or whatever, you can go find out where your exit plan is, but it's posted in your lobby. Any other questions? Okay. That could get pretty deep. I mean, as far as mental health, I mean, that's might need a psychologist to talk about something like that. You know what I mean? Well, yeah. I mean, unfortunately, there's a lot of arson that goes on in our community. Memphis is pretty high in arson, and you know, it's also that's the same as other violence that happens as well. I mean, gun violence, knife violence, anything that happens kind of happens quickly and easily, and that involves starting fires and setting fires too. I'd say probably majority of arson is automobile arson, and that's a lot of times domestic related. So the domestic related issues are going to end up with something that has to do with that. That could be starting someone's home on fire, starting their automobile on fire, whatever. But that's going to go back to original crime safety, you know, as far as arson, because it's crime. So that's you know, getting pretty deep on that topic. Anything else you guys want to talk about? You got free reign, you know, to ask us any questions. Okay. Yeah, I mean, water safety is going to be out of our realm. When you have an incident, we're going to respond to anything you call 911 for. But as far as teaching, how to stay away from water and water safety, that would be outside of our realm. Um, you know, that's true. That's true. They need to know a lot about just being safe in general, So, yeah, I'm not sure exactly. I mean, you could possibly start with the YMCA as starting with, a facility on, you're saying who would teach possibly swimming or safety or falling in water or something like that? Right. Right. I would say, I mean, even starting in school and community centers, learning how to swim and learning, general life procedures on, just being out in public and walking around lakes and rivers and things like that. If water, is flooding under a creek or whatever, don't go near the creeks, just general safety on staying away from something if you're unsure of it. So like we get rain and you have a viaduct or an underpass and you're going under it and you see water, they always say turn around, don't drown, sort of thing. Don't play in ditches or creeks or whatever, and always have an adult, tell an adult where you're going. I mean, that would be the thing to do, is to just tell the kids that it could be dangerous, Mhm. Do we have a what? I'm sorry, I don't understand the question again. Tell me one more time. Oh, an app.
Concerning possible drowning. And even if you can't do it, maybe someone that you work with can advocate and say, hey, this is something we need to start teaching, because I don't think it's enough to say, well, these are the resources. I think that might need to target some organization, some agency, to specifically say we have an issue here and we need to have some help to get it addressed.
Right. Kind of like similar to, so we have a fire museum saying, correspond with active shooter as well, or something similar to that. But
Yes.
like I said, drownings
It's
or
just
whatever.
that you all would have
I
the
see.
ability to network a little bit better than maybe us as an individual, because you're an organization. You can say, hey, this is not our area, but we need to address this and address it now. Our kids are dying.
Right.
So,
Right. Yeah, that's a good point. I see that. Right. I'm unaware of anything that what you could do. You could actually, I mean, if you were willing to do it, is write a letter to the fire museum and mention something like that. If there's something in particular that you were concerned about, saying, hey, I know you guys teach fire safety. I know you do this. But as far as, from the fire department standpoint of view, I mean, they're probably willing to talk to you about it. I mean, the people that are there, it's their full-time job is to educate the community on what we do, and, they like to have your input on that. So, I mean, I could give you your information, if you want me to. Okay, I'll send it to you. I'll be around and talk to you when we get out of here.
Okay, our format is allowing for each presenter to present for 15 minutes. So I think you have 2 minutes left.
Oh, that's fine.
We want to be timely, but we want to get all the information out. And for those of you who are not from Memphis, you have a local fire department in your community, and I would suggest that that would be a start for you to address some of the concerns and questions that have come up here today.
Sure. And you guys are always welcome to come by our fire station anytime you want. Your local fire station, and come talk to us and meet us. We'll be glad to talk to you about whatever you want to talk about. So.
All right. Thank you so much. You are more than welcome to stay. However, if you get a call, we do understand.
We'll head on out. Thank you.
Okay, our next presenter is Dr. Jessie McGee. So, Dr. McGee, these are some questions, and these are some things that we need to think about. Thinking about our current pediatric population, what is the projection of heart-related illnesses as they become adults? Another thing to think about is that a lot of our communities have food deserts and people don't have the proper grocery store and or nutrition that they need. And how does this affect heart disease? And what advice would you give these families who don't have access to quality foods? And what role, and I know you are affiliated with the National Medical Association, what role does the association play in policy to address these needs, and whatever else that you would like to share with the group? Dr. McGee.
All right. First of all, I wanted to just thank you for the invitation to come and share some information about really the status of health care. We look all over the nation, but particularly here in Tennessee. I've just recently had throat surgery. I had a mass resected from my vocal cord, but I can still talk. So if I'm a little low, I'm going to pick it up. I serve as the executive secretary for the Volunteer State Medical Association and have an opportunity to go all over the state of Tennessee looking at the status of health care of our citizens, as well as to educate physicians on optimal practice of medicine. There are several issues that confront the medical community at this time, and I think you can always make a decision if you're armed with knowledge. And so that's what really the Medical Society try to do, is arm you with knowledge on the decisions that you make in regard to your health care. There are 5 realms that we kind of look at. And one of those happens to be the access to health care. Coming up in October through the end of the year, you're going to have make a decision on what type of health care that you want. One of those is that those that are over 65, you have the opportunity to get Medicare. But be careful on signing up for all of these things that you have no knowledge about. Get some information from someone, the medical society, or your physicians, on what you're going to sign up for. I just left Jackson, Mississippi a few days ago when a person who signed up for one of these, really I call them just crazy plans, he ended up having a stroke, and the insurance company don't want to cover anything. So be careful on these things that you sign up for. I always tell people, get an opinion from your physician or someone who's knowledgeable about what you need to sign up for. Sometimes they say, well, you know, you can save $20 because this plan is cheaper, but on the back end, you end up paying $3,000 for it. So the advice that I would have in terms of getting access, when you sign up for these Medicare programs, get something that allow you to go anywhere you want to go. If you get sick out in Arizona, you need to be able to go to the physicians and hospital there in Arizona. So don't let these plans restrict you. I say that because I see a lot of Afro-Americans who get tied up saving $20 on the front end, and then you pay all of that, or they want, you know, the friend in Jackson, they want him to go to Shreveport, Louisiana to get stroke care. To me, that's just absolutely nonsense. So one warning is that we need to be cognizant of what we sign up for. The second thing now is that when we talk about food deserts and other things, it's not just only food deserts. There are non-medical things that determine your health outcome. And we call those social determinants of health care. One of those happens to be housing. If you live in inadequate housing where there's toxic fumes that around your house every day, you have toxic water, toxic air, your outcome is not going to be as good. There's lots of chemical companies who like to set up shop in various communities and not make the community aware of the side effects of those chemicals that are being made in their community. Nobody wants a chemical shop next door to you. And so we have to be cognizant of that. There's a place here in Memphis where the cancer rate is so high from people living in that area. And no one wants to do a darn thing about it. Now, I dare to say that if that happens out in Germantown, something would have been done yesterday. So that's one of those. The second thing is food. When you're talking about food deserts, the certain conditions that we have, hypertension, diabetes, and there's no grocery store where you can get a yellow banana. There's no store or any area where you can get healthy foods. So we have to be cognizant of that. The other things that affects our community is at our schools. I just had an incident where 6 children, 2 sisters moved in a 2-bedroom house. Now there's 6 children who've got to get up to go to school in the morning. Well, there's no breakfast been served, no guidance on brushing their teeth in the morning. And so they get to school. Their outcome not going to be as well as you had those things that were present there in the morning. So there are many other determinants we call social determinants. And when it comes to adults, we've got some traditional diseases that we have to be cognizant of. And one of those is diabetes, another one hypertension, another coronary disease, breast cancer, and prostate cancer. Those diseases affect us much worse than other populations. Now, there's so many medicines out there now I don't know, anyone can afford them. You don't have an insurance, and so the Biden administration recently has done some things to try to be sure people get insulin. I didn't realize insulin was $140 a day for some of these insulin products. Who can afford that? And so we have to be cognizant of that. The other thing is that we tend to forget is climate damage. You know, I'm also a farmer. I planted corn and peas and all of the vegetables. Well, the corn burned up. I mean, the sun just burned it up. Not only mine, but all the other farmers there in southern Mississippi. Now, what's going to happen to the price of corn? It's going to double. So it's just we have to be aware of that. The other thing in our community is violence. That affects it just affects every aspect of our life in our community. I read some statistics about violence. I went to Chicago, Illinois over the 3-day weekend. There were 67 shootings and 17 deaths over a weekend. Now, you just can't sustain that. What are we going to do about it? And of course, 99% of them were gun-related deaths. People just put a gun on, and to resolve any conflict, you end up, instead of, in my day, we used to do a fist fight or something, but nowadays just pull out a gun and just get rid of you. So we have to be aware of that. I want to finally settle in on prostate and breast cancer and vaccines. We hear a lot about the vaccines that's going on, you've got so much disinformation out about vaccines. And where should we be on these vaccines? You hear, well, it took them 3 months to develop. These vaccines have been in production for 8 to 10 years. They didn't just come off the docket yesterday and use them today. So we have to educate ourselves when it comes to vaccine. Where would we be today if you didn't get your polio vaccine? Well, I remember as a kid, and I had a relative in that was polio, but I remember that little black car coming through the dusty roads of Mississippi, giving us those polio vaccines. And then later the one that you take by mouth with the little sugar cube. Now, what if we didn't get that? So when it comes down to getting vaccines, don't be fooled. Educate yourself about it. You need the vaccines if you can tolerate it. Now, there are some people who have some reaction to that vaccine, but a sore arm is better than death. And so educate yourself when it comes to that vaccine. These things are approved by the Federal Drug Administration and the Center for Disease Control. And their job is to be sure that whatever is out here is safe. And they make the best guess based upon scientific evidence that that is what it is safe. Otherwise, they wouldn't approve it. So get your flu vaccine. And if the government say if the CDC and the FDA say you need another booster, get it, because that may be the only chance that you have. Look at how many deaths we had from that vaccine, and then you still got folks putting out disinformation about it, using unproven things such as ivermectin. I mean, that's a horse medicine for horse worms. And to get you to use that stuff is so we have to educate ourselves. That's why forums like this and the medical society forums tend to educate us on what we should be doing. The final thing, how many minutes I got it? All right. The other thing I want is to talk about prostate cancer in men. Well, I don't want to get that test. Well, get the test. Don't let the insurance dictate what you need to take care of yourself. I went to my doctor and he said, well, your insurance won't cover this exam till next year. I said, listen, don't make no decision based upon my income about my health care. And you shouldn't either. Your doctor can fight for you. When your insurance folks turn you down, your doctor can fight for you and get some of the things that you need to have. And then the last thing is about breast cancer. Of course, I've covered a lot of little things, but this just has to highlight it. Get your mammogram. We got a disease, and then if you got belly pain and all that, get taken care of. There's a cancer that's rising faster than any other cancer that I've seen, and it's deadly, and that's pancreatic cancer. There's no good cure, and it kills you. So you need to be sure that we take it and get your mammograms, and don't let nobody tell you, well, you don't need it for another 5 years. That's nonsense. So you have to arm yourself. You need to know what your blood pressure is. You need to know what your cholesterol is. You need to know your own information. You roll up into a doctor's office and say, well, your blood pressure is 170/100. You're doing pretty good. You're not. So we need to arm ourselves with knowledge. And on that note, I'm going to stop and answer any questions that you might have. Well, there are two things is that you can get health care called Affordable Care Act or Obamacare. And what it is, if you're in the private level, it's a prorated plan. So if you below that poverty level, it's a graded plan. If you have nothing, the more the government will pay for it. So you can get it. And that's probably one of the greatest things that I saw as a well, I can say we got an insurance expert in here, and that's right there. She can tell you how that works because she works up. She knows how that works. And what happened is the governor still, as far as Medicaid expansion, to me it just absolutely make no sense to leave that much money in the poor state like Mississippi and Tennessee, who do not expand Medicaid is absolutely ludicrous. And believe me, how much money you got determines many times what kind of quality of care you get. Now, now I'm a consumer. Go there and the guy, well, insurance won't pay for it. Well, I need it. So I'm just letting me die because the insurance won't cover it. So So we have to be advocates. Now the medical side, the Volunteer State Medical Association, have chapters in Jackson, Tennessee, Nashville, and in Chattanooga and in Memphis. We have these 4 regions, and we're always giving educational seminars and health fair. And we have the state convention on each one of those major regions. We just had it here in Memphis. Great attendance, and it's going to be in Nashville next year. And it would be nice to have your presence there because it's a statewide event, the second weekend in June. It'll be in Nashville in conjunction with Meharry. All right. Well, the reason they're closing, they don't have any money. And and so why not expand Medicaid? Medicaid will pay for that. That's what makes no sense about it. Why are you going to let a hospital close in the next place is 40, 50 miles away when you can pay the bills there and keep that place open? So with that, we need whatever pressure that's been applied is not working. Just need more people. And that's really it. Rural care they need health care like everyone else. And so that's where we are with that. Yes. I'm not an OB or an expert in that, but I can just from the general medical community. And one of those is the principles of the Volunteer State Medical Association is that I can't tell you how to handle your body. It's between you, God, and your family. I don't have that right to tell you what to do with it. Secondly is that maternal fetal mortality rate is very, very high. And there have been many programs available to reduce that. And I think over the last, I've just looked at statistics not too long ago, it's coming down. So there's been improvement. Prenatal health care is so much, it's been encouraged. It's you know, your outcome gonna be better if you go to the doctor to get prenatal care versus no care. Just show up at the time you deliver. And of course your outcome isn't gonna be as well. So that is getting better. But as far as the abortion and all of that, you know, you can't get that here. And for the immediate future, I can't see how that's going to happen. So it's going to be a voteless people, it's a hopeless people. So it's going to have to be determined at the ballot box.
Okay, thank you, Dr. McGee. We have room for one more question, I think. Well, was there one more question, Dr. Millicent?
Yeah, it's called the Volunteer State Medical Association, which is part of the National Medical Association. And we go to Nashville every 3 months. That's our schedule to the health committee. So we've, to me, it's just not been effective. And we got to keep coming. We got to keep there. It just, they seem not to listen to what we have to say. And I don't know how we can make that change except voting them out. But you get some of those folks from East Tennessee, you can forget it. You come out of Memphis, they don't want to hear nothing you have to say.
All right, thank you so much, Dr. McGee. And I also would like to thank Mrs. McGee, his agent, for allowing and for both of you all being here today. So our next topic, and somebody mentioned infant mortality. That is a critical thing that's going on in the African American community. So at this time, I would like to have Vicki Terry address you all with the program that the Memphis branch is doing called My Baby for Me. And she also has experts with her, Lori and Joel Archibald. And Joel Archibald. Vicki.
Okay, good evening, everyone. Good afternoon. My name is Vicki Terry, and I'm the Executive Director of the NAACP Memphis branch. And about a year and a half ago, I had someone to call me from the Jesus Christ Church of the Latter-day Saints and wanted to meet with me. He said that President Johnson and Amos Brown had gotten together and the church wanted to donate some money to the Memphis branch NAACP. Y'all forgive me, my sinuses are draining real bad and I got so hot a few minutes ago I thought I was gonna pass out, but I'm okay now. But anyway, they called and, you know, at first I was like, oh no, who are these people calling? I don't wanna, you know, I don't have time to talk to nobody or anything, but they called and they came down and they wanted to meet with me. And at the time, Van Turner was the president, but he wasn't able to meet. So what we did, we talked about what was going on here in the city of Memphis. and they asked me, what was it that, and Elder Holland says that I told him what keeps me up at night, what makes me think about the issues and problems, and we talked about the infant mortality rate. I don't know if you all know, but here in Memphis, Tennessee, the zip code where our branch is located, 38126, it has the highest infant mortality rate in the country. And we talked about that and talked about some other things, and when they left, they called me back and they said, hey, you know what? We want to help you all address this problem. And then he told me someone was going to come down and work with me. And these are my two angels. They have come down. They gave up they are retired. He's a retired pharmacist and she's a retired nurse. And they decided they wanted to come down and help us with this. So they were loaned to me for 18 months. I'm not going to let them go because they practically run this program, My Baby for Me. And they're going to talk about it. I don't know if they got the video up where they can talk about it, but they are experts in this. And what we do, we have class every Tuesday from 4 to 6, every Thursday during lunchtime from 11 to 1, and on every third Saturday. And when I say this program, it started back in November, and it has grown leaps and bounds. And we are helping. They're going to talk about what we're doing because we are going beyond what we're supposed to do. When I say this couple, they have helped so many women and their children as far as getting homing, because we've had homeless women and children. They found apartments, they've gotten furniture. I mean, every day I tell them, y'all are just doing too much because these women are so spoiled now. They call them at midnight, wanting to, the Archibalds, can you all help me? And they would get up. They have went to the hospital. I mean, they've just done everything they need to do. So I'm just going to turn it over to them. I tell you, and the church, they pledged $500,000 for this program. So we have started renovations at our branch because they wanted the Memphis branch to have that look. We are doing a new conference room. We're going to have a new commercial kitchen where we're able to cook for these families and just do whatever we need to do to help. And we're reaching out to other organizations. They're going to tell you about our partners and everything because I can go on and on, but I'm going to introduce you to Lynn and Joelle Archibald. Thank you so much.
Thank you. Great to have the opportunity. Are we able to do those few slides that we brought? Is that a yes? I don't know. They're not up. It's all right.
Oh, there it is.
Oh, cool. Well, that's they're working on it. We're the Archibalds. We're from Oregon. Vicki has given you a great background. Oh, hey, it's coming. So as was explained, and you probably know, 38126, worst infant mortality rates in Tennessee, and Tennessee is one of the worst in the country. And the U.S. is poor, pitiful, really, for the sophisticated healthcare system that we have. We're like 33rd in non-third world countries. It's pretty abysmal. So our effort is to reduce infant and maternal mortality in Shelby County. Let's go to the next slide. This is the president of our church, who's a cardiologist. He's 99 years old, Russell M. Nelson. And this is the Reverend Dr. Amos Brown, who is the San Francisco NAACP branch president. And they are good friends. And they're good people. So, president of our church, President Nelson, addressed the National NAACP Convention in 2019. You can read that if you want to. I know we need to get through these slides, but he says we're all connected and we have a God-given responsibility to make life better for those around us. And in the end, he says, if we have any hope of reclaiming the goodwill and sense of humanity for which we yearn, it must begin with each of us, one person at a time. Next slide, please. And thanks for the slides. Appreciate your help up there. This is what Reverend Brown said. This very partnership of the NAACP and the Church of Jesus Christ of Latter-day Saints will be the saving factor to redeem the soul of the United States. Look at the church, look at the NAACP, for if you take what they use of love, civility, justice, and peace, you won't lose. So awesome statements from leadership at national levels. Next slide. You know this lady. So as she said, she kind of told you the story, so we don't need to take a lot of time. Church leaders came, said, hey, can we drift that in?
One more click.
One more click. So this is what she said. She's told you about that. It didn't take her long to come up with that answer. Next slide. It's pretty cool that she would be knowledgeable and know that about this area. Joelle's going to talk for a sec.
So infant mortality really is the number of babies that die between birth and 1 year of life, and it's measured in a rate per 1,000 live births. So it's a baby that's born alive but doesn't live to celebrate a first birthday. And as we talked about, the data doesn't look very good for Shelby County and for Tennessee and for the United States as a whole. Here's some information on disparities or different outcomes for Black women and women of other races. 8% of births are to Black women in the United States, but Black babies are 2 to 3 times more likely to die in that first year of life compared to white babies. The rate of prematurity is 50% higher among Black infants, and prematurity is one of the biggest contributors to infant mortality. Babies born too little to survive or to survive and have a good outcome. And when compared to other racial and ethnic groups, Black women experience much, much higher rates of serious pregnancy complications and death in the first year after having a baby. Data, the United States ranks poorly, right? Tennessee rates are worse than the United States as a whole. Shelby County rates are worse than Tennessee as a whole. And Black women in Shelby County have worse outcomes than races as a whole. 89 Shelby County infants died before their first birthday in 2020. And that's just too many, right? We are lovers of children. We are parents of 6 and grandparents of 16. No baby should die before their first birthday. Okay, next slide. This is the chart. The red arrow there shows you where the United States is ranked compared to other countries. The next slide. This is data from the United States. Tennessee is the second set of graphs. The third line is Shelby County. And the fourth line, and you see the further extension to your right, is Black women in Shelby County, higher rates in 2018, 19, and 20. Next slide. Why do we have so many disparities in these outcomes and these float in? I'm not going to go through these individually, but this distinguished doctor here talked about the things that can impact health in general. We know that going to your doctor, we all think that's health care, but health outcomes depend on much, much more than that clinical interaction with your provider. It depends on the community you live. You can keep floating these in. Income, transportation, housing insecurity, not enough food, stress, access to health care, domestic violence, chronic health conditions prior to pregnancy, all of those things. Next click. These have become known as the social determinants of health because they happen at the community level, at the neighborhood level. And all of these things, next click, play into health outcomes with our women, as well as practices after delivery, feeding practices, safe sleep, having a safe place to put your baby down to bed, and knowing about reducing sudden infant death syndrome or sudden unexplained death syndrome, using a car seat consistently, being aware of what food is appropriate for a baby so you're not introducing solids and causing a choking hazard, eliminating risks and hazards that are safety risks for infants that are beginning to explore in the home. Okay. So the next question was, between the church and Vicki and the NAACP, is, are there approaches out there that are effective in reducing infant mortality with a similar population?
Obviously, if you don't have to reinvent the wheel and you can find it somewhere, that's helpful. So go ahead and click. So one of the members of our church, who's a physician who's based in Little Rock, went looking for programs. He's not an obstetrician, he's not in maternal child health, but in Columbus at Ohio State, he found a program called Moms to Be. They've been in existence for over a dozen years, and they've shown statistically and published in the literature the impact that they've had, and it's been good on infant mortality. So they said, very graciously said, you can have our curriculum. You can change it, you can develop it, you can modify it, you can use it as it is, which is a great gift. Next slide. This is the brochure for our program. We have some here. We just want you to see it. You can see that to make this work, there are a lot of community partners involved, and they're listed there. But it helps to address and sort of outline some of the things that Vicki mentioned about our program. Next slide. 4 B's for My Baby for Me.
We want these women to feel like they belong. They come to an environment that is accepting and loving and inclusive, and that they are gathered with people that are like them, other mothers who are pregnant, other mothers parenting young children. We want them to believe that they have the ability to succeed in life and to succeed in being a good mom. We want them to be aware of risks. What does a contraction feel like? So that if you go into labor or start having unusual feelings, and it's 4 months from your due date, we can get you the attention that you need to prevent a preterm birth. What are other things that are normal or abnormal? And then finally, to become. We want each of them to achieve their potential as beautiful mothers of children, and we want each child to reach their full potential. Next slide. We'll just go briefly over the core elements of My Baby for Me. It's a group setting, as Vicki mentioned. It's a class. We spend about the first 45 minutes or so doing an education session on a topic related to their health or their baby's health and wellness. And then we feed everyone that comes a meal. Women are welcome to bring their support people. We love it when dads come. There are very few that come. And women can bring their other children with them because we don't want childcare to be a barrier. We provide transportation to and from classes. There is no charge for any of this. And then we enjoy a meal together, and then we send them away with a $10 Kroger gift card as an incentive for attending, with a bag of shelf-stable groceries to stretch their food dollars for that next week, and with diapers and wipes for their children. Okay, the next series of slides are pictures. We'd just like to go into those pictures. This is Dr. Ashley Matthews. She's a family practice doctor, and she heads the University of Tennessee Family Practice Residency Program. She came recently and talked to our women about blood pressure risk. This is staff from Regional 1 who came and talked to our women, an OB navigator and the director of clinical services. Next slide. This is just one of our class environments. They're a happy, noisy place with children and volunteers who are helping in the same room with the children. Next slide.
This is Tamara from the Extension Service. I don't know if you're aware, but they will come to your group, and she'll bring stuff, and she'll cook a meal, and she'll say, this is how to do it. She'll talk about vegetables, she'll talk about fruit, she'll talk about farmers markets. And what she makes, she shares, and everybody gets a sample, and it's delicious. So it's pretty cool. And then just another picture of our class. I don't know how that got in there.
Next slide.
Yeah, quickly.
We had a CPR class where Labanner brought dummies, infant dummies, to practice on, and the women learned really valuable skills about how to deal with their child if they're choking and how to do CPR. Next picture, again, just instructional aspect. Next one. These kids love Vicki, and Vicki loves these kids. So she's in and out of class almost every session. Next slide. A little bit of a progress report. We don't need to go over those numbers or belabor them, but we're showing exponential increases. Technically, the program launched November 29th of 2022. This is January, February, and March. It was the first quarter, the second quarter, and still growing. We want more women to come. We love welcoming them. Next slide. Our experience so far. We have loved the support that we've received from, back from the NAACP, from their staff and their leadership, and from all of the partners. Everyone that we talk to about this is all in. How can you argue with having more babies having a first birthday? There is nothing that, no difference between us that would transcend that core belief. And women and their families are participating and coming. Next slide, and this is our last. These are 3 of our recent babies. We've had 7 babies born to women who have participated in the program, all 3 healthy term babies. This is very one-by-one work. Teaching them in class, developing a trusting relationship with them, and outside of class, assisting with the things that are those social determinants of health that would impact their health outcomes. So we're really excited about the babies we're going to meet in the future. And this is our contact information, and you can always just reach out to the NAACP.
Thank you. Thanks for this opportunity. Really appreciate it.
As she said, we've had 7 babies born since November, since we started this program, and we had a 15-year-old that I think the baby's maybe, 2 months almost now. She gave birth. So we have young mothers as well that don't know the first thing about being a mother. And then we have some that are estranged from their family, and we have become their family. I mean, when I say they call the Archibalds for everything, can you take me to the grocery store? Can you take me or get somebody? They were, and when I say this, I am so honest because they took the time when they would finish the program. We had one mother whose vehicle had, been repossessed or something. So they would take their children, and how many, Dominique has, to school in the morning, pick them up in the evening. And when I say they go over and beyond just helping these women, and it has been a blessing to me. They would say, I don't have gas money, have paid utility bills and everything. So we are reaching out to partners all over the city so that we can make sure that these resources are taken care of. They forgot to tell you, they have a program where we have a baby shower for every mother when it's their time. A lay at the church, their church does layets, gives them everything they could possibly need to start their family. Baby beds have been donated, and it just touches my heart. It really does. One of the young ones that I was holding, he's autistic, and he was so withdrawn at first, but he is now coming and running to you, and he's starting to say some words. So it is really a blessing to all of us. We get emotional when we talk about it, because when you see these women, some of these women, she had one woman, she has 7 children. She just went to the doctor, found out she's pregnant with twins. It's 9 children. She's not even 30 years old. So we're just trying to teach them a better way of life, trying to even teach them about birth control and everything, because when you have these many kids, you can't take care of all of this on your own, and you don't have that other person, no family there to help you. So it's the NAACP in the church, and we've got Baptist Hospital. They are so on board, and Regional 1, we just had meetings with them. So it's just a blessing that we are here and we're doing what we're doing, and it's all because of our president, Derek Johnson, and the president of the Church of the Latter-day Saints, and Mr. Amos Brown, that this program has come into fruition. And thank you.
thank you. Yep, there's some brochures for information for you. And the other thing, with this, I had an opportunity in the last few weeks to visit the program briefly. I ran into Vicki on the street and we were trying to get all organized for this convention. And she said, come on in here and see the program and see, meet the families. The little kid that she talked about that was autistic just ran to me, and I was like, maybe it's because I'm old and I'm a grandmother and he could sense that. And we just had the best time, and it's a great program. For those of you who are not from Memphis, we talked about the zip code for the NAACP office. This church sits in 38126, which is the zip code. So we are very appreciative of the partnership, and we just have to do what we can do to keep these babies living. We do that. We have children, we have grandchildren. I'm looking at Miss Carter, who her children are fantastic, and then we had an opportunity to meet her grandchildren. And so every child deserves that opportunity. So, okay, I won't keep going because I'm supposed to be on a time schedule here. So our next presenter, and Vicki talked about with the mothers, you can imagine the stress that they may go through or they just don't know. And the stress we go through. We look at the news, we see the fires, we see the floods all around the world, and it is stressful, people. It really is. You think, oh, I'm just living in my own bubble and I'm doing my own thing. And my husband, who's here, is like an avid CNN watcher. So all day, something's going on that may cause stress, concern, PTSD. And so our next experts, Dr. Barnes and Miss Laurie Powell, will share information about mental health. And that's a topic we kind of don't want to talk about it. We don't talk about it, but we need to talk about it. Dr. McGee mentioned gun violence, stuff like that. So they're going to share their thoughts on mental illness, and go ahead and just talk about a little about the stigma.
Hey, can you hear me okay? My name is Laurie Powell, and I'm the CEO of Alliance Healthcare, and we're here in Memphis, Shelby County. And I told Dr. Barnes here, she and I can kind of do this together. We presented together in Nashville at Meharry. Was it the American
Black Psychiatrists of America.
together with Dr. Stewart, who couldn't be here today because she's presenting somewhere in Chicago. She's a world traveler and everything. So, but we're excited to be here. And the more that we do this, we do hear from everybody that we present to. Either you yourself have had an issue or trouble with mental health, depression, anxiety, alcohol or drug use issues, or a family member who has. And since COVID, we are seeing people at least talk about it more. I would say if there's anything positive that came out of COVID, it's talking about, wow, I need to take care of myself. And that includes my total health, which is mental health, right? And somebody I was talking to earlier said, look at your brain just like another muscle, if you will. It's an organ. You go get your heart checked, you go get your mammograms, and you need to take care of your mental health and well-being. So do you want to start talking? I don't want to bore you with stats, but I'll tell you a little bit about, we are seeing a rise in suicide. I think it's rising the highest among ages, and you can correct me if I'm wrong, 5 to 18 Black men. And we're seeing it increase among young Black females as well. And it's still, I think it was the second leading cause of death among Black youth now.
Right, and risen to the third leading cause from for teenagers, and then total for 5 to 18. And it's surprising because we used to have a lot of pride in the fact that we're lower. Right, like we didn't have the same rates, but it's actually raising. And so we're kind of in this point of crisis and figuring out what do we do to intervene, how do we listen to our kids and what's going on. I recently moved to Memphis from St. Louis. Came here specifically to work with Dr. Stewart at the University of Tennessee Health Sciences Center and the community and the Center for Youth Advocacy and Wellbeing, where we help connect children with services in the community. But specifically when I was interviewing, I met with Lori and we were talking about the community mental health environment here and how do we, because it really does take a community to build mental health and well-being. And so that's where I practice. And then I see kids on a regular basis that are presenting with some of those issues. But then we partner with organizations like the Memphis Shelby School District and the Memphis Police Department and the Fire Department to figure out what are the initiatives that are supporting our kids. And I'm looking forward to also partnering, if we aren't already, with My Baby for Me to figure out how do we take care of the kids past that first year and get them early intervention and screenings. So we work with kids that are with chronic illnesses, those moving upstream that may be involved with gang violence, but before that, even having trouble with being unhoused, those social determinants of health that were mentioned, because we talk a lot about what happened to a child versus just what's wrong with the child. You know, you see the child misbehaving in the grocery store or misbehaving sometimes in church, and you're like, what's going on in that family? But really, what's happening in that household? What are they being exposed to? What resources do they have or may they not have? And a lot of it, especially post-COVID, we're realizing is people are isolated. They don't have the same family connections, the same relationships, and that's more dangerous than smoking. And research has come out that if you're isolated and lonely, your risk of death is the same as if you were a pack-a-day smoker. So that, you know, I don't know that we've taken that seriously in the past as we do now. And so building that community, working with, we provide wraparound services, working with the entire family to build that community around the child is important. And with COVID, with everybody isolated, we saw a lot of that, but also with social media with our children are facing. They're growing up with the iPhone. This is they call them the I generation, the first generation that's grown up completely knowing a smartphone. I mean, when I was growing up, I still had a flip phone. So, you know, like a rotary phone, they don't understand those kind of, right, those symbols. So, but that operating and communicating with people only through text message and social media also doesn't provide the same oxytocin, positive hormone release that it does when you're seeing somebody face to face, having them smile, talk to you, touch you, you know, holding hands, and just being in the presence of community. So I think that's the other piece that we're trying to say, because this crisis isn't just an increase of prevalence of depression, anxiety, but there's things that have happened in our world that have also leading to some of those same challenges. So how do we provide those safeguards for our kids to help out with that? And that's what we're working with.
And I wanted to mention one of my passions has always been the mentally ill that are incarcerated that don't need to be there. And there's 1 in 4 individuals that are incarcerated that have mental illness. Some of those individuals really need to be diverted to treatment instead of the revolving door. And so that's one of the programs we have at Alliance. And she was mentioning partnerships with police and fire. We have something called the CARE team, and that stands for Crisis Assessment Response to Emergencies, and that's where one of our master's level clinicians will go out in the field with a medic an EMT from the fire department, and then a CIT officer trained in de-escalation to just make sure the scene is safe for the intervention and assessment to take place. And then the EMT from the fire department will screen to make sure there's no barriers to going ahead and linking them into treatment. And so it's we've been to the jails here. We've done a tour. We hope that we can make an impact. I'm sure you've seen the stories in the news lately about people dying in the jail. They might have been having a psychotic episode. I think that was in the paper yesterday. And it's just a shame, and our community can do much better. So we hope we're going to see an expansion of those services. We are building a crisis center here. We had our groundbreaking on Friday, and my friends from UT were there, and our first responders, and all of our partners from the hospitals were there, because we want people to get into care immediately, remove those barriers to access to care. And we're Alliance Healthcare. We have 7 outpatient clinics, housing, criminal justice programs, and just a full array of addiction programs. We're the only provider for the uninsured that have opiate addiction, alcohol addiction, and need to be detoxed and then immediately taken into treatment. But again, let's look at that. 1 in 4 in jail have mental health issues, and we just have to do a better job at screening, identifying, get them into treatment. And the stats also say that people are in jail longer that have a mental illness because they can't really advocate for themselves. And so that's just really something that we're going to continue to address at Alliance, is what can we do to help? We have around 450 staff now and growing, but I'm so excited about this crisis center because we'll be able to serve more individuals. Where we are right now, we are the largest crisis provider in the state of Tennessee. We see around 13,000 to 15,000 individuals in crisis. That's in the community, in the emergency rooms. And we want to have a welcoming therapeutic space, and so we are building a 55,000 square foot facility there in Binghamton, and I think the community, it can only lift the community up if we're working with all of our community partners, including Baptist Hospital, where they're in their emergency rooms, Methodist, Regional 1, we have partnerships and programs with them, and of course our friends at University of Tennessee. And I mentioned this the other day, we can't operate in silos. We have to operate as community partners because there's plenty of money and people to go around that need help, and if we don't work together, they've got things that we don't do, we have things that they don't do, and we can partner and do research, and then that drives funding for what we do here. So and we also want to meet the person where they are. So removing those barriers to access also means we'll be in churches. So we have a partnership with Pastor Young, the Healing Center. We are there with her, and her Healing Center, it's called Wellness Center there, on Monday nights, where they see the uninsured. They have psychiatrists, medical doctors, and then our Alliance therapists to screen people that need help, and then we'll get them to where they need to be, because when you have a mental health issue, 60% will go to their pastor, minister, and I personally have done that myself, right? When I'm suffering, go to your minister. And then what we're trying to do is educate that Black people do kill themselves, right? And that Suicide in the Black Church Conference that's here in Memphis every 2 years. It's just, if you have a chance, come to that. Put on by Pastor Young, and carried on, her late husband, Bishop Young, that started that. But it is such an awesome conference, so I'm going to put a plug in for that. But just educate. we're here in Memphis, and I get asked that question a lot. The reason why we haven't moved outside of Memphis, we serve around 20,000 people a year here, is because until the need is met in Memphis, as a CEO, I don't feel comfortable to spread into another county because there's so much stigma around behavioral health and addiction. We'll expand once everybody's taken care of here. So I had some stats that from the state, the Department of Mental Health, that I think it was around 13% of people with mental health issues here, I actually think it's higher, are not really seeking help or getting the help that they need. I actually think that number's higher. I don't know where they got that number, but again, I wanted to address something. You guys were talking about health care and insurance status. We really do need to expand Medicaid. I know that Antonio Parkinson, our representative, was really trying to push for that here. I think, because we're on the, and some of my staff members are here, we're on the Legislative Committee for Behavioral Health, and I know that he plans to bring that up next year and really push for that. And there were actually a couple of Republican supporters at that time, so there just wasn't enough time in that special session, is what Parkinson told me. And he says call him Touche, but Touche said there wasn't enough support for that, and so we have to let the government know, it's mainly the Republicans, we have to let them know that we want this expansion of Medicaid, because even though there's something called behavioral health safety net for uninsured for mental health, for the poverty level, it doesn't cover the primary care needs. So I don't know if you guys have ever heard of Behavioral Health Safety Net. It covers someone with a mental health diagnosis. It's all across the state of Tennessee. However, if that person is hospitalized, it's not going to pay for that. And so I think the average hospitalization for a psychiatric emergency is $20,000. So we need to push for that. I'm pushing for that. Someone told Governor Lee when he was here at our groundbreaking, we need that. And we did get $7 million from the state of Tennessee for this crisis building, and I think that's the most Memphis has gotten for any kind of Binghamton, 3200 Broad. And so I've met with, that's right there at the back door of Pastor, and I've met with him multiple times. Everybody has my cell phone. If you're having a crisis emergency, a family member, reach out to us. You know, I think I brought my card, but we want people to, that need help, to get the help that they need. So I could talk all day about mental health, and I know you can too. But we're in the schools, yes. There are questions. We do have programs in the schools because we need to start younger so that we can do that prevention piece. And unfortunately, there's not a whole lot of funding. Right? I mean, it starts when you have a diagnosis.
Yeah. What has happened is that oftentimes if I get called to the emergency room and patients may have other issues, but I know the predominant issue is a psychological issue, a psychiatric issue. That's where the trouble begins. You can't get them adequate care. And you do all you can, and they end up sending them home. You know they shouldn't go home, but what options have you got? And that's where I meant by the barriers.
Right.
And is there any hope for that? Because if you see them in the emergency room and there's a psychiatric issue going on, they shouldn't go home. Now, if you label them depressed, you might be able to get something, but if it's other issues, that's where the obstacles are.
And here in Memphis, I mean, I think they've really, Methodist, Baptist, Regional 1, St. Francis, they've asked our staff to, you know, we're 24/7, our operation, so they've asked our staff to be available for psychiatric emergencies. And we're just trying to expand that and be able to meet the need. It's relatively new, and this concept, this facility, will be able to expand that. And so you've got your first responders. I should have brought the video for you guys to see of what the finished product will look like, because there's nothing like it in the country that I've seen. It will be so welcoming. She's seen it. I can't wait for it to be built, because I think it will people will want to get help even if they're not in a suicidal emergency, because it's going to be so welcoming there in that community. But I did have a point there. Oh, so we divert around 400 to 500 people from jail every month through our first responder program. It's the CIT police will. And so this one gentleman was listening to, he's a former police officer, and he just happened to be telling me that the first 3 calls he heard came in. One was a naked man on a roof that was going to jump off. Another one was a person that was bipolar having an emergency, and another one was a suicidal person. That was the first 3 calls coming in to the police. So just yesterday, so that's our Memphis Police Department getting those calls. So you guys, this is, very serious. And one of the things I've always heard Dr. Stewart say, and you want to talk a little bit about trauma in our community and how Memphis has experienced so much trauma, racial trauma, the Tyree Nichols incident, and when we all got together and spoke at a church about that. But it seems like once you have that, then you've got the other, and 2 weeks later, you haven't even finished thinking about this, and then the next thing happens, and it's just one thing after the other. And so some people have protective factors. I didn't know if you wanted to talk about trauma, because that's your areas.
Yeah, well, when we
2
have
minutes.
some
Sorry, I'm
2
rattling
minutes.
on.
Okay. I'll just say this. This is the quote that she says that risk factors are not predictive factors without protective factors, because of protective factors. And so we're working to build those protective factors in our community. And we all know the risk factors that we face here, but working to kind of counter those with protective factors. But I do want to leave some time for questions as well. Yes.
So we have one question. Mr. Carter?
Right. Well, they need to bring them to our crisis unit so we can start them immediately on medication and then link them to community resources. They shouldn't go to jail. And that's why we're building a 55,000 square foot space to really address that. I mean, I don't know why I've always go. Did you want to add to that? I would like to hear what your solution is, though, because you're a police officer. What do you see? That's a good answer, yeah. Oh, yeah. Wow, don't get me started on that. Thanks for bringing that up, yeah. Right. Well, I will say one positive thing in response to that is there's something called the School-Based Behavioral Health Liaison Program that was just started. The goal is, do you remember all that funding where they said they were going to put a security officer in every school after the shooting in Nashville? Well, now they're saying they're going to put a master's level therapist in every school that's trained on this trauma evidence-based intervention called School-Based Behavioral Health Liaison, and it's based on that pyramid evidence-based program where the bottom level of the pyramid is education around trauma for teachers, educators, support staff at the school level, and then the next level will be, well, how do the teachers identify some of these behavioral health issues and link them to, well, that person might have experienced some trauma, and then link those individuals to groups at that school where they will be able to have some coping skills and learning about how to cope with trauma, And then if they need more than just that, support, then they will be linked to a community mental health provider that can do more evidence-based intervention, like, for example, trauma-focused cognitive behavioral health therapy, which is a really great evidence-based intervention for children and youth who have trauma. And their family will learn too, because a lot of people don't know how to just take in a deep breath and breathe out, or how to identify anxiety. Some people are walking out in a constant state of anxiety because they're trauma and they don't even know how to identify that, for example. Well, she and I love to present together. Add Dr. Stewart to that and it's a comedy routine.
All right, so I'll be getting in touch with you to hopefully do it in Jackson or maybe Nashville or somewhere so people can better know. Maybe Nashville has something. I know Jackson and Rural West does not have anything like this at all. The other piece is we put money, I was on the governor's task force to identify the new funding formula for TISA, the new funding formula. We actually put money in there for every student that had some kind of mental condition, that was special ed. They get an extra amount of money within their school system to help so that they can hire somebody like that. Are you guys seeing, do you have a request from schools? We're just going in, 24 is the start of spending the money.
That's good.
So is money there? So are you getting requests from schools to see students? We need to know if they really spending it, they're doing something else with it.
What's that acronym stand for again?
Let me see.
Write that down.
Somebody,
But it's for children with special needs?
yeah, it's for all children.
This-
TISA is Tennessee, oh, Lord have mercy. Somebody else.
I'll look it up, but
Yeah, but it's the new funding formula for state funds that go to school systems.
okay.
Yes, and it gives more to children with mental health issues.
Oh.
Gives more to children with disabilities, et cetera. So if I'm a child that's in a low poverty area and with a disability, I get 25, extra 25% of the total for my low poverty, another 25% for my mental illness, another 25% because I'm a special needs child. So it puts money in there to make sure that the school has the money needed to actually be able to serve its child.
Well, and that's so important too, because we find that kids leave school because they're not learning in school, right? They don't have the accommodations that they need, and then they fall into these groups. These that become risk factors for substance use and hanging out.
People that believe most kids that wind up in gangs or in some of those things have been traumatized at home or somewhere in their lives.
yes, right.
So they're trying to figure out how to act out this, and they will leave school. So
Right. Well, I'm going to say some of that funding is the reason why we were told there's $120 million across the state to do these school-based behavioral health liaisons around trauma.
it is. That is why.
Well, so you good job.
Well, it was not easy, and we want to make sure it does go for the kids that need it the most, because, we stop a lot of problems
Right.
if we address them when they 4, 5, 6 years old.
That's right. And those, yeah. Oh, me too. Right. Okay.
Yeah, that's a great question, and we're happy to partner as well about programmatic activities and consult with you. But I think starting with having a group get together to talk about these mental health issues and creating that space, coping mechanisms. You can have some things that we do with teenagers or young kids is have them build a calm down jar where they put all of the glitter in a jar and then they shake it up and it shows all of their emotions all over the place, and then how with time it calms down. But you can make it a hands-on doing activity for your younger kids, but you could also do more just creating safe spaces for older kids to talk about what stresses they have in the school or in their lives currently. Alongside that, it's really important to also work with parents. So they're not learning a skill that their parents are not aware of. And the American Academy for Child and Adolescent Psychiatry has a lot of resources like Facts for Families that describe different diagnoses, and they're designed for teachers, parents, kids, and you can even use that as a study guide for topics to go over in these groups. But really thinking about what are the topics that they're most facing, and I would, just based off of the epidemiology, I would say depression, anxiety, substance use disorder, and in youth, adolescents, it's usually marijuana and or cannabis and alcohol, the most common, but especially marijuana now because it's legal in so many states. But we know that there's evidence, especially with youth in their brain development, that there's detrimental, it affects their ability to grow and executive functioning specifically, so their ability to make decisions when they're impulsive and they're saying driving under the influence, things like that. It's important to tackle those issues that they're seeing in their schools, that they're seeing, and provide space so they know, even though you may see this debate on TV about legalization of marijuana, as a child, these are the detrimental effects that you're going to face.
I wanted to add something to that. We probably want to put you in touch with, in the Department of Mental Health, there's a faith-based initiatives related to educating congregations around mental health. And I'm having a senior moment. I can't remember the guy's name, but I went to one of the trainings at a church here in Memphis, and it was so well done. And it trains anybody that wants to be trained in the church how to address trauma and identify it and work with the entire church. So I'll give you. Okay. Yeah, I'll get it to you, and because he's such a great guy. I didn't answer your question, though. You had one for me. Okay, the crisis. So the Crisis Stabilization Unit, I look like I'm going to stab you with that, doesn't it? The Crisis Stabilization Unit is not a licensed hospital, but people can stay there, for up to 5 days if they need to be stabilized on medication. There is the detox program there that's a 9-day stay for opiates, alcohol, benzodiazepines, like Xanax and Valium and that type of thing too. And then a respite, three bed. Usually it's a shorter stay if somebody just needs to get out of their community environment that's stressing them out and causing them to have some mental distress. But I did hear about the negative impact of Lakeshore closing to that community. And so what we're seeing is as these psychiatric facilities close down, you are seeing, as the gentleman said earlier, the retired police officer, you're seeing more people incarcerated because they might see somebody acting out on the street and they just don't know what to do with that person. So let me just go take them to jail, and that's just not the answer. So we really need to take a look at what we're doing at the state level.
Okay,
Right, I've heard about that in Knoxville, yeah.
Okay, we are now down to about 10 more minutes to go. We'll take one more question, And then I have a question for each panelist, and then we'll conclude.
Right. Well, eventually the plan is for that, school-based behavioral health liaison, which has that ACE foundation. Now, I haven't gone through the training, but I'm hoping it will be in every school in the entire state if that's the goal,
Okay, so you've heard some very, very thought-provoking presentations. Can we agree on that? I have one last question, and now we have maybe about 8 minutes, and the question is for each one of you panelists. What is our call to action as the NAACP? What is the one takeaway for the NAACP? And I'll start with you, Dr. McGee.
Well, I think there are two things that I would say. One is that for the NAACP, let our community know what resources are available for us when we have issues that we can't handle. And and one of those is educational. Educate, educate, educate. If you do that, you can make a better decision. And I always used to say, and I'll say that even now, whenever I had an issue that I just could not resolve, I went down on the one who could give you the best answer with his wisdom, and that's the good Lord. Take it to him. And I can't tell you the experiences I had in that cardiac catheterization laboratory when the wire wouldn't go. And I called on him and the wire went right through. And so those are experiences I have never forgotten, and so call on the one who knows all. Thank you.
Yes, I think everybody has mentioned and acknowledged that there's a mental health crisis. If you watch CNN or see any news story, you see a lot of things that would cause you to feel anxious. So I think now is the time to build space to discuss and address those issues. And for children specifically, it's creating those communities around them to protect them, because, I was looking, I'm a fan of W.E. Du Bois, and one of the things that he talks about is the immortal child, and that not your child, but your children's children will be the effect of what we're living through today. And so how do we care for them? And so I think it's important just to address the moment and create those spaces to talk about mental health. I can, it can take care of severe mental illness and things that, when the brain isn't working, but a lot of those start with our communities and having access to food, having access to a loving, caring adult, having access to housing and support system and education. So I think those are the issue of our time to address.
And I would echo the education, educate around mental health awareness. If you have a chance to attend mental health first aid training, bring that into your church. And of course, I'll give her the gentleman's name that I've talked to a million times now. I can't remember it. He does the faith-based initiative training that's excellent. And advocate, I was surprised how much the legislators listened, when we had a group of 20 together or what have you. Get to know your legislators. We've got to expand Medicaid. It's just crazy that we don't have it, because that's why the hospitals are closing, and we're losing people. They're dying. So advocate, advocate, advocate.
Okay, in our last,
Thank you.
okay, so it is about 4 minutes to 4. President Sweetlow believes on starting on time and ending on time. So we have 3 minutes, and I would just like to thank our panelists, Dr. McGee, Dr. Barnes, Mrs. Powell, Vicki Terry, Memphis President Kermit Moore, the Archibalds with My Baby for Me. I asked Vicki when we were saying what should be our next step. She said, we are the NAACP, and we know hearing from these experts what we should be doing in our communities. We'll have information and contact people so that you can move forward and advance the causes of health for your community. So thank you for your time. Thank you for your attention. It's always good to see fellow UT alum Cynthia Finch, who came down from Knoxville, and good evening.